today we have Don Charlson here. He is an acupuncturist and traditional Chinese medicine practitioner, and he works with Family Chiropractic Associates in Scarborough. And I will let him explain more about what he does and his training and his practice. So without further ado, here is Don.
Thank you, Kim. As Kim mentioned, my name is Don Charlson. I'm a licensed acupuncturist working with Scarborough Family Chiropractic in Scarborough. I've been with the practice for about 2 years and in practice for over 20. I've had practices in Rockland, Maine, and also Albuquerque, New Mexico. I'll tell you a little bit about myself. I started my journey in healthcare and helping people as a flight medic stationed in Germany during the end of the Cold War and during Desert Storm. After I'd gotten out, I had gotten my associate degree of nursing at Central Maine Medical Center, worked as a nurse for about a 2 decade, actually closer to 25 years, focusing mostly on emergency nursing and critical care. I do have a specialty certification as an emergency nurse, did both acupuncture and nursing for about a 2 decade period, and stopped working as a nurse about 2 or 3 years ago. I have a Master's of Science in Oriental Medicine. I studied at Southwest Acupuncture College, graduated in 1998. I also studied in Beijing, China. The picture on the slide is Dongzhou Hospital of Traditional Chinese Medicine in Beijing. This is where I studied. I'm nationally board certified in acupuncture and again have over 20 years of practice. Acupuncture itself has been in practice for over 3,000 years in China. It is the oldest continually practiced form of medicine. Before there were metal needles, sharpened pieces of stone were used as acupuncture needles. Traditional Chinese medicine is a very literate medicine. The first text was written in 100 BC and it was writing about things within acupuncture and the theory of traditional Chinese medicine during about 2000 BC. Many of its ideas are still used in practice today. Even though acupuncture and traditional Chinese medicine has been used by Chinese immigrants since they've been in our country for well over 120 years, most Americans didn't know about acupuncture until James Reston had written an article in the New York Times. James Reston was a journalist with the New York Times, traveling with President Nixon in 1971 during his first trip to China. During that trip, he developed an acute appendicitis and required surgery. As a part of his anesthesia and also postoperative pain management, acupuncture was used. He had written about his experience upon his return from China. He made a big splash. And from then, fast forward to 2021, there are over 50 schools accredited for the study of acupuncture and East Asian medicine. All states have a mechanism for licensure, and there are about 20 to 30,000 licensed acupuncturists practicing in the United States today. Today we're going to be talking about acupuncture and self-care techniques for the treatment of insomnia, anxiety, and seasonal affective disorder, or also known as seasonal depression. During my studies, I had the opportunity to listen to a gentleman. His name is Bob Flaws. Translates a lot of Chinese medicine into English, and he once said that unfulfilled desire is the root of all disease. And when we think about it, oftentimes when we want something, want to be something, do something, have something, and we're not able to, it creates some discord in the body, both physiologically and also psychologically. Over a period of time, if that endures, and if we don't either get what we would like to have or be who we would like to be, and if we aren't able to change how we think, that challenge of where we want to be as opposed to where we are can create dissatisfaction, ultimately disease, especially in the context of insomnia, anxiety, and seasonal depression. First, we're going to talk about insomnia. I'm a big Snoopy fan, so even Snoopy has a wandering mind. Overall, insomnia affects about 38% of the population. Almost half of all healthcare providers experience insomnia. During the pandemic, the prevalence has actually increased to 40 to 50% of all people, especially people who are actively quarantining or limiting their social interaction, as well as people who have contracted COVID. Underlying problems that can either cause or lead to or contribute to insomnia is anxiety, depression, and restless leg syndromes. When I'm doing my initial evaluation, I will also screen for these things to see, one, if they're present, and to also see what impact they have on someone's difficulty either going to or staying asleep. A quote by a Chinese physician, it once said, sleep is yin and ruled by the spirit. If the spirit is quiet, this leads to sleep. If the spirit is not quiet, there is no sleep. So spirit here refers to our mind. Many times when I'm treating patients and I inquire, what do they feel the cause of them not being able to, especially either go to sleep or if they wake up, go back to sleep. They say my mind is always racing. Within the theory of traditional Chinese medicine, a spirit that is not quiet is as a result of a deficiency of yin. So the treatment strategy would be to help quiet the spirit and also nourish yin. When I'm treating people, I also recommend some self-care techniques. That way, whether they are seeing me or being proactive in managing their insomnia, they're receiving some form of treatment. The first thing I'll mention is establishing a regular bedtime routine. What I recommend to my patients is that they pick the earliest time that they need to wake up, then make sure they're in bed at least 7 to 9 hours before, allowing some time for them to relax. I recommend them to develop a ritual, whether it be reading a book, listening to quiet music, something that they can do on a regular basis to help them fall more easily asleep. I also recommend people avoid daytime naps. If someone feels that naps are beneficial, I recommend not napping for a period of any more than 20 to 30 minutes. If I'm working with patients who do shift work, especially healthcare workers, doctors, nurses, and others, I will recommend that they sleep in what I call 90-minute blocks, and that allows the body to experience restorative sleep and complete REM cycles. I also recommend regular daily exercise. The current recommendation is 30 minutes of moderate exercise. I tell my patients that, anything that you do, even if it's going for a half-hour walk, again, a little bit of something is better than a whole lot of nothing. With that being said, I don't recommend engaging in exercise 2 hours before going to sleep. It's also important to avoid stimulants. That could be TV, some combination of TV, alcohol, caffeinated drinks. If people like to drink either coffee or tea, I recommend they not have any before noon or 2 p.m. And then with TV, what I recommend doing is finding things they enjoy doing to help them relax. When I'm working with people, I know there's a lot of things that I've mentioned, talk about either not doing or taking away. When working with someone who is looking to make a significant change to address their insomnia, we focus on things they can add. The technique is called crowding out. So instead of saying you can't watch any TV, I recommend they spend half an hour reading. So as a result, if they read for half an hour, they watch less TV. And so we focus on those things to make it easier to assimilate new activities, to develop that pre-bedtime ritual. When I treat people with insomnia, I do recommend that they receive treatment ideally 3 times per week. The reason is when someone is not getting restorative sleep, it has an impact on other areas of their life, whether it be their energy level, how they feel. They could be at risk for other health problems long term. So I do recommend a more aggressive treatment. Treatment is best scheduled in either the afternoon or evening. Ideally, when you read literature, and traditionally speaking, acupuncture done within half an hour to hour of sleep is most efficacious. Logistically a challenge, so again, recommend afternoon or early evening treatments. Common protocol is needing Anyan, Intong, and 4 gates. Anyan is a point that's used specifically for treating insomnia, and it's just behind the ear on the head. Intong is the point between the eyes. It's in the picture. And then 4 gates refers to a point that lies between the index finger and thumb, and then also between the great and second toe. If there are other specific patterns, I'm also focusing on either for insomnia or other concerns. I'll add points appropriate for that imbalance or pattern. Anxiety. Before the pandemic, 30% of the people experienced some form of anxiety, whether it be a mild to moderate, all the way up to full-blown panic disorder. However, since the pandemic, it's been 40% or greater, and it's been as high as 50%, and people have had to quarantine, and also COVID patients. Anxiety is characterized by an unsubstantiated and disproportionate response to what's going on with their daily life. Many people will avoid others in social interactions, and is a way many people self-manage. They'll develop rituals around repetitive behavior, hand washing, more severe forms, cutting, and other things. For better or worse, Western medicine often uses benzodiazepines for the treatment of anxiety. Benzodiazepines include Xanax, Valium. These medications are addictive. While if perceived to be effective in the short term, definitely carry some longer term risk. So certainly encourage people to focus on self-care, talk therapy, acupuncture. Self-care for anxiety includes, again, daily regular exercise, again, ideally 30 minutes, establishing a bedtime routine. Any routine that's healthy is encouraged, and also listening to a guided meditation. I'm a big fan of Insight Timer. Acupuncture treatment for anxiety, again, 2 to 3 times a week, dependent upon the severity of the condition. Oftentimes people are sensitive to needles, so I will either use fewer and or thinner needles, and will also use less stimulation. Common acupuncture protocols include Intong, which is a point that was on the slide between the eyes, Shenting, and Bahui. Shenting is a point in the center of the forehead and the hairline, and Bahui, or Du 20, is an acupuncture point on top of the head. A very effective combination. Again, we'll add points for other patterns as needed. Seasonal affective disorder affects about 20% of the population, traditionally more so people living in the northern climates, New England, Canada, upper Midwest. We have shorter days, colder weather. Even though climate aside, it's people who have, again, quarantine and COVID patients have also shown signs of either seasonal depression, seasonal affective disorder. The things that affect people normally, social isolation, not being able to go outside, are the same things that we're all experiencing with the pandemic. In the treatment of depression, there's a famous quote that says, in all the many cases of depression, the cause is qi, that which is not regulated or coursing. The treatment must first normalize the flow of qi. When treating depression, I'll focus on acupuncture points or Chinese herb that have to do with the regulation of qi. A really good example is the point combination of 4 gates that I mentioned previously. There are also points in the center of the sternum that's also used. Bahui, Shenting also used as well. Self-care recommendations for people with seasonal depression include daily exercise. I really encourage people to be outside as much as possible. For people suffering with seasonal depression, as little as 15 minutes of sunlight outdoors is really beneficial. Light therapy can also be really helpful. The one thing that I keep in mind is there's actually, if you have seasonal depression, and those people benefit from light therapy, or what's called a dawn simulator, which is a light that gradually increases in terms of the amount of light in the morning to simulate that sunlight. It helps people get up and get moving. The one time I would be cautious about a light box is when someone is exhibiting signs and symptoms of seasonal depression with a bipolar component. Those people tend not to do as well with a light box, but do well with a dawn simulator. Give talked about spending time outdoors. Connecting with others is really important. Even though we're not able to do so like we used to indoors, we can certainly get creative. Technology like either Microsoft Teams, Zoom, Google Hangout, FaceTime, really focusing on that connection regardless of how we do it. So whether we're 6 feet away and physically in front of someone, whether through it's a screen, it's really important to maintain those relationships. Focusing on the positive. When I work with people with seasonal depression and other forms of depression, I'll ask them to write down 3 positive things that have occurred each day. And then when they come back for their following treatment, I ask them to tell me about one thing that really stands out for them. It's also really important to do something you enjoy every day. Given the times that we're in, we may have to be a little creative. Juggling is always an option. But anyways, if you're not able to do the things that you're able to, it's really important to cultivate something that you enjoy doing, that you're able to do. Treatment for seasonal depression, again, dependent upon severity, we'll do either 2 to 3 times a week. Acupuncture is most effective for qi constraint. Qi constraint as a pattern for seasonal affective disorder. These people will often have a pulse that has a tighter quality to it. There may be some irritability intermittently. Stress will have a disproportionate effect, or life events. Chinese herbs are often recommended for people that have patterns of acuity or deficiency. Those are people that will have a low energy, may not be very active, more what I call that traditional depressive state. Acupuncture, again, yin tong, Bahui 220, the point on top of the head. Xiao Gu is a point just above the ear on the side, very, very effective. Again, other points are added on either the back, hands, feet, as needed, depending upon patterns. Alrighty, that's the share portion. Kim, more than happy to answer any questions. I don't know if you'd like me to start with the one you'd mentioned during the registration, or if you would like to start with questions that people may have typed in during the presentation.
So didn't have any questions as far as during the presentation. Am I echoing?
A little bit. What I'll do, I'll mute my end. Actually, it's not bad. Go ahead.
Okay. I was wondering if when you're using mostly, I guess, for sleep or even during times of anxiety, are there pressure points that people can do this on their own without having to do acupuncture at the time, obviously, because it's situational?
Yes, excellent question. So actually, what I'm going to do is find my camera, and then given the okay, so a point for you can push is right here, this intong,
Mm-hmm.
and then what I do sometimes is push this point here. This point I haven't talked about is on the stomach meridian in conjunction with here and pushing in. Then Shui Gu is a point that's here. That I talked about 4 gates. So that is a point that this one point is here. And you push is also a very effective point for headaches. And then also between the great and second toe is the other half of that point combination. So that's just kind of the real quick down and dirty.
Okay. So is that mainly for insomnia, or is it kind of everything that it's just good spots for?
Good question. It could be across the board.
Okay. And then I don't know if you want to address the other question that you got ahead of time regarding low back pain. It's kind of outside of the scope of this talk, but if you just want to address it real quickly.
Absolutely. So what Kim is referring to, that someone had a question about acupuncture's treatment with low back pain, chronic low back pain, if memory serves me correct. I'll address both, but certainly acupuncture is effective. There have been studies showing its effectiveness with acute injuries of low back pain as well as chronic low back pain. What's interesting about chronic low back pain is that Medicare, under certain conditions, is starting to cover acupuncture for it because licensed acupuncturists are not participating Medicare providers yet. There has to be a referring physician who also does the billing. The supervision stipulated is considered general. The Centers for Medicare and Medicaid Services are still working through the fine details. Insurance companies that cover acupuncture, all of them cover for the treatment of back pain, including the VA. I see a lot of patients with chronic low back pain. I don't know of any insurance companies that if they cover acupuncture, then they cover the treatment of low back pain. Quickly speaking, when someone has an acute back pain injury, there's a point sometimes I'll needle here for the point and have them walk around. Then there are points local to the back that I'll do. For some people that have back pain, their pain's actually from a tight psoas muscle. And for those people, that is a muscle that connects to the lower lumbar spine and then pelvis and then the upper portion of the femur. And if it's either spasms or contracted, then it'll cause a shift in the pelvis. Either in severe cases, the pelvis may either rotate or become unleveled, and they'll experience excruciating pain, especially when they go from a sitting to a standing position. And those people I will treat lying on their back. I'll use acupuncture electrical stimulation to release the psoas muscle, as well as treat the pain. There are also points away from the back on the lower leg that I use for treating back pain as well.
Okay. And I assume that you also recommend maybe some exercises that will help to keep those whatever adjustments that you do, or it's not really an adjustment.
It's an acupuncture treatment. Fair question. In some states that some manipulations allowed, there's a form of body work with Oriental medicine. But yes, there's a Qigong movement that I really like. If the psoas muscle is involved, there'll be stretches for the psoas muscle and hip flexors that I'll recommend and show people. And then again, encourage some form of activity. During either a flare-up or acute phase of injury, we'll be cautious about the type of movement. Some movement is good, but they want to be careful not to overdo it. With chronic pain, movement is very important, but again, making sure they do things that helps their back from getting tight or experiencing more pain, but not overdoing it or exacerbating their injury.
Okay.